Uh-oh. Did we lose Renelle? Oh, she's muted.
Let me
There
go
we
knock
go.
on her
There we
door.
go.
Okay, she's back.
So welcome everyone to our second session today about our open enrollment for 2026. Thank you for joining us. We have some important information to go through today. So thank you for taking an hour out to go through it with us. Today we have a couple people that will be going through our presentation with us, which is Mackenzie Montgomery, who is the director of our accounts at Tricordia, who was formerly known as Montgomery Graham. So if they've been with us for a while, just under a new name. And then Scott Lyda, who is the Director of Sales and Employee Benefits for Tricordia. And we also have some vendor representatives that will introduce themselves when they come up to their section of the presentation. So sit back and relax, listen, and if you have any questions, please put it in the chat and we'll do our best to answer those questions as they come up. So take it away, Mackenzie.
Perfect. I'm actually going to pass to Scott.
Great. Thank you, Renelle. And thank you for the introduction. Again, my name is Scott, and I'm with Mackenzie and also Ashley. We are here with Trucordia. And the special guests that are with us are Cindy from Kaiser, and we have Lillian from Willamette Dental, and I believe we have Max here from Mutual of Omaha. So we've got a good team here. We got a lot to cover, so I'll keep moving here quickly. Open enrollment actually starts tomorrow, so you'll receive an email from an employee navigator that states you have until November 30th at 9 p.m. to complete your enrollment. The actual effective date is January 1st. And it's called an active enrollment, and that means everybody needs to log into this employee navigator link, and you can re-elect the same benefits, you can add or remove dependents, you can change your beneficiary, you can make changes within the programs, or you can waive coverage. So this is the time to do that over that next 16 days. And there, in terms of our agenda, we have your Kaiser program is excellent. Your dental program is through Willamette Dental and Mutual of Omaha. You have vision through VSP. You have your flexible spending account and your dependent care account through Paylocity. And for your life, disability, accident, and critical illness, you have Mutual of Omaha. And you have some great benefits, some supplemental benefits through Transamerica, which is offering a permanent life and long-term care solution, as well as Figo pet insurance. All of your contributions will be available in Employee Navigator. But just wanted to give you a little update here. For 2026, there was an overall increase of about 10% from Kaiser. Not all plans were exactly the same, but the good news is that Willamette Vital Health has assumed 75% of all those increases. So they do an outstanding job here. You have just a slight increase from Willamette Dental and a slight increase from Mutual of Omaha dental plans. And all of your other programs saw no increases for 2026. You do have to work 30 hours a week to be eligible for your medical, dental, life, and disability benefits. And it's just 20 hours a week to be eligible for your voluntary benefits. And with that, I will pass it over to Cindy.
Hello and welcome to Open Enrollment. My name is Cindy and I'm with Kaiser Permanente and I'm the account manager for Willamette Vital Health. So today we're going to go over just your basic benefits. There's been no changes to the plans, so we'll go through them kind of quickly. So with the Kaiser HRA plan, it is a high deductible health plan that when you look at the benefit summary or SBC that you see, you'll see it has a $1,700 deductible with a $3,400 deductible for family. And then it also has an out-of-pocket maximum of $2,500 for individual and $5,000 for family. However, Willamette Vital Health is amazing as usual, and they offer an HRA to go along with this particular plan of $1,500 for individual, $3,000 for family. An HRA is a health reimbursement account. So it's money that you have that Willamette Vital Health provides to you to go through and help pay for the expenses that are on this plan. So when all is said and done, you would have $200 left of your deductible or $1,000 left of your out-of-pocket max altogether. So just to kind of cover some of the basics on the health plan itself. So when we're looking at this type of plan, you do have to meet your deductible prior to anything being paid on the account. Of course, while you're meeting that deductible, you can use your HRA funds as well to help pay for those costs. Once your deductible is met and your HRA is exhausted, then you would pay 10% of any of the costs, other than maybe a few here and there, until you reach the total out-of-pocket maximum, and then the plan will pay 100%. So during that time frame, if you go to the primary care or specialty visit, you would pay 10% after your HRA is exhausted, and the $200 that's left on your deductible is exhausted. But then once your out-of-pocket max is met, then you would pay zero, as it shows on here. That goes the same for your basic services. So your primary specialty visits, your urgent care, any lab work scans, ER visits, hospital stays. Prescriptions are a little bit different. Once your deductible and out-of-pocket are met and the HRA is exhausted, then you have a copay. Well, actually, once your deductible is met, you have a copay. Once your out-of-pocket max is met, then you don't pay anything at all. Acupuncture, chiropractic, and massage therapy fall into the alternative care bucket. There was a change this year. It was really a name change only. We used CHP Group as our network for these types of services, for all of your alternative care stuff, and the name changed to Haraya Health. It's HERAYA health.com is where you would go to look for a provider for any of the acupuncture, chiropractic, naturopath, or massage therapy visits. If you still go to chpgroup.com to look for a provider, you'll get pushed over to the Haraya Health website. Again, that's name change only. Network itself is still the same. And then you have vision exam benefit as well, but that does also go towards deductible and coinsurance, and then your out-of-pocket max. Unless you've met all of those things, then you would pay zero for a vision exam. Just to dig in a little bit more too, as far as the HRA benefit itself goes. So we know you have the $1,500 employee only, $3,000 employee family benefit. So when you have services through a Kaiser Permanente provider, your claim will automatically go through the system, through the Kaiser Permanente Health Account Services, or WEX, for processing. So you should not receive any bills until your HRA is exhausted. Then you would receive some, because there would be some out of pocket to you. But once the HRA is exhausted, then you would pay whatever's remainder. If you visit a provider that does not bill Kaiser Permanente directly, you would receive a bill for that. You can file that manually through the system to be reimbursed. A good example of that would be, maybe you go to a massage therapist that might be in network, but for some reason they're not billing Kaiser. Then you would just go ahead and bill that direct, or manually file that claim to have that paid back to you, less your copay. If you fill a prescription at Kaiser, you would use your HRA debit card to pay for that prescription at the pharmacy, or for any mail order prescriptions that you order. If you happen to fill a prescription at a Med Impact pharmacy, this would be more on your added choice plan, then you would need to file a claim manually with WEX to be able to be reimbursed for the cost of the claim. Going on, we'll go ahead and go to the HMO plan. So this plan is for Kaiser Permanente providers only. So medical providers within a facility, lab work, pharmacy, all within a Kaiser facility. So with this one, you have a $750 deductible with a $3,250 max out of pocket. This one does not have any HRA funds that go towards this, but you do have first dollar benefits, unlike the other plan where you would have to meet everything first. So first dollar benefits, what I mean by that is really having your primary care office visits. You get the first 3 visits for $5, and then it's a $20 copay. Your specialist visits and urgent care, again, you have a copay for those. X-ray and lab work, for those, these are department visits, so $20 per department visit. And what that means is that if you go in and you have, say, 5 labs that you need to have completed, you only pay the $20. The same thing if you had, say, an X-ray on your leg and your foot, then those would all be within that $20 per department visit. Scans is the same thing. It is a per department visit, a little bit more expensive at $100 because these are more of the specialty scans. So when you think about CAT scans, PET scans, MRIs, things like that, if you were doing 2 of those things at the same time, then it would be considered the per department visit. Emergency room is 20% coinsurance after deductible. So you would go $750 for an emergency room visit to start with. And then if it's more than that, then you would pay 20% coinsurance until you meet that $3,250 out of pocket. Keep in mind when it comes to the deductible and out of pocket that those aren't separate numbers. The deductible actually does go into the out of pocket as well. So it's not a $4,000 out of pocket, it's a $3,250 out of pocket because you would have already met that deductible. So it goes in there and lessens it. One thing to just point out is that an urgent care visit is $40 versus that $750 deductible plus the out of pocket. So if you have an opportunity to use urgent care instead of the emergency room, it will definitely save you some money. For prescriptions, you have a $15 copay for generic, $30 copay for brand, and $50 copay for non-preferred. And then your alternative care services, acupuncture, naturopathic, massage therapy, all a $25 copay. And then there's visit maximums that are annually. So 12 visits on both acupuncture and massage therapy, 20 visits for chiropractic. There are no max visit limits for your naturopath benefit, which is a $20 copay instead of $25. And then your vision exam, there's not a hardware benefit, is $20, and you do get that vision exam once a year. You can go ahead and move on. The Kaiser Added Choice or Point of Service Plan, this one is definitely one that has a lot of different moving parts and pieces. So there's 3 tiers to this plan. Your first tier is your Kaiser HMO, so Kaiser facilities. So you're seeking services through a Kaiser provider or having labs or pharmacy done through a Kaiser facility. Your tier 2 is your PPO network. The PPO network that we use is First Choice Health. So one thing to keep in mind here is that with First Choice Health, we don't have the entire network for First Choice Health. So when you're going in and you're looking for a provider under the First Choice Health network, you don't want to go in and just straight go to the First Choice Health network site. If you were to do that, you would find providers that aren't necessarily in network. So if you go online and go to kp.org/added-choice/Northwest, you would be able to click on a few other things in there, but get to the First Choice Health network there, and you would know that you're actually looking at the providers that Kaiser offers through that network. Tier 3 is all others. So that means you can go to any provider you want to. Non-contracted is typically what falls into this tier. One thing I want to call out is that when you're looking at tiers 1 and 2, those benefits cross accumulate. And we'll talk about that a little bit more later. But that means that anything you do in tier 1 goes towards your deductible and out of pocket for tier 2 and vice versa. Tier 3 is a standalone plan. So it's almost like having its own plan. So nothing cross accumulates with your tier 3 benefits. So you would have your own deductible and out of pocket for those services. So definitely better to stay within that tier 1 and tier 2 if you can. You do, of course, have access to all of the tiers. When you're seeking services through a PPO provider or a non-contracted provider, and they're ordering things like lab, x-ray, maybe more of those specialty scans, you can certainly bring those orders into Kaiser and have them done at Kaiser so that you're getting the Kaiser pricing versus getting the PPO pricing. And then, of course, Kaiser and PPO providers can both coordinate for second opinions. So then to dig in a little bit, so your Kaiser HMO Tier 1 is very similar to the last plan that we went over. So this one does have a $750 deductible. The out-of-pocket is $2,250, of course, employee only. You have first dollar benefits on this one, just like you do on the other plan where you've got a copay for most of your services, department visits for $25 or $100 when you're looking at x-ray, lab work, or specialty scans. Your emergency room visit on this one is $200 after you've met your deductible. So you meet the 750 and then it's 200. On the previous plan, it was 20% co-insurance after your deductible. So definitely a little different. If you're admitted to the hospital, there is a 20% after deductible benefit. And then your pharmacy is the same on this one for $15 generic, $30 brand, and $50 non-preferred brand. And then here for alternative care, again, Haraya Health is the new name. $25 for all services for acupuncture, chiropractic, naturopathic, and massage therapy, with everything having an office visit or a max number of visits, except for naturopath. And then, of course, you have your $25 vision exam once a year on this plan as well. Looking into tier 2, as you'll notice from tier 1, you had a $750 deductible in tier 1. So tier 2, it goes up a little bit. So now you're at a $1,500 deductible. You've got an out-of-pocket maximum of $4,500 instead of the $2,250 if you were to seek services through Kaiser. So the cross accumulation piece that I was talking about really goes into say, let's say, for example, you spent $750 of your deductible going to a PPO provider. That means you would have already met your deductible on your tier 1 because you've already met $750 in tier 2. The same thing goes the opposite way. If you had met $750 of your deductible in tier 1, then that means you've also met $750 of your deductible in tier 2. You do still have first dollar benefits in this tier as well. They are a little bit higher than what they were under tier 1. So in this one, you've got a $35 office visit, $45 specialist, or a $55 urgent care. Your lab and x-ray still department visit at $35 per department visit. Your scans are 30% after deductible versus a $100 copay like what you saw in tier 1. So this is in that piece where we say if you can bring any of those orders in and have them done at Kaiser, you would save a little bit of money rather than having to meet the deductible first and then paying 30%. Emergency room is still the $200 after deductible. Hospital stay does go up from 20% to 30%. And then when it comes to prescriptions, it's a little bit different on this plan. So it's Med Impact. Med Impact is our out-of-network pharmacy. You can look up Med Impact online as well to find various locations for where you can go. You do have a little bit of a higher copay on here, and mail order is done through CVS, and maybe not all mail order that you would be able to get, and maybe not always at 2 times where you get on your tier 1 or your HMO plans, you've got 2 copays for the price of a 90-day supply. You may not get that as much on the Med Impact as you do going to a Kaiser pharmacy. So another just kind of slide in for saying if you can bring your pharmacy into Kaiser, then it will save you a little bit of money as well. And the mail order might end up being a little bit better. Acupuncture, chiropractic, and massage therapy do change up here as well. So now you're 20% after deductible with the same visit maxes as you had before, but you would need to meet the deductible first. And then naturopath does stay at a copay, a little bit of a higher copay and no visit maximum. And then your vision exam on this tier is $35 once every 12 months. And then going on to tier 3, this is the one I was talking about where this is kind of its own standalone plan. So you see the deductible and the out-of-pocket maximum has gone up as well. So if you were to do services, let's just take the tier 2. So $1,500, $4,500 was your deductible out-of-pocket. So you could ultimately spend all of that for your deductible and your out-of-pocket in tier 2. And then if you were using out-of-network services, then you could do the same here. So an additional $2,250 or $6,000 out of pocket. So if you're adding those together, it definitely adds up. So if you can stay in that tier 1, tier 2, definitely will save you some money. Also on this one, you find that you're getting to the 40% after deductible. So not the first dollar benefits for a lot of the services like you're seeing in tier 1 and tier 2. So you would meet your deductible first and then 40% co-insurance until you meet the $6,000 out-of-pocket max. Acupuncture, chiropractic all goes under that same 40% after deductible. For prescriptions, it's different. It still follows the $20 copay for generic, 40 for brand or non-preferred brand, and 60 for brand. Vision exam, 40% after deductible, the same here. So you can see the differences kind of between all of the tiers, and definitely watching the network would be ideal in this case. And then moving on from here, just to kind of cover some of the other services. So we know that times are tough and mental health is definitely something that's big for a lot of people. And we want you to know that we've changed some of our processes and procedures. And I do think I've talked about this over the last couple of years where, it used to be that you had to kind of go through a couple of different steps to be able to get to the right provider for being able to seek services and schedule appointments. And we have changed that so that you can actually self-refer. You can do that straight through kp.org. You can get support for a wide range of conditions like anxiety, depression, substance use disorder, autism spectrum disorders. You can seek services through a psychiatrist, a psychologist, a marriage and family therapist. But again, you can make your appointment for these types of therapies directly within Kaiser Permanente. You do not need a referral, and you can schedule most of those services online directly. And then we also offer kind of some self-care apps as well. If we want to skip to the next slide. So with these are meant to just kind of help overall well-being, right? So we want the best for everybody. So we start with the Calm app, and this one really is for meditation and sleep. It's designed to help lower stress, reduce anxiety, build resilience. For this one, you can get daily calm reminders. You can get some meditation stuff. There's your sleep stories, which are amazing just to kind of help clear the mind so you don't overthink things when you go to bed like I do. And you can listen to the story instead. And then we also offer Headspace. So Headspace has gone through some name changes over the years, but with Headspace, it's an emotional support coach by text message. But there's also other self-care activities. You've got meditation, you've got sleep stuff, how to get moving, music. There's podcasts on here. There's other self-care resources as well. So when we're breaking that down just a little bit, so with the emotional support coach by text, the one thing that's different with that is you get 90 days a year. We don't have a way of being able to extend that. So what I like to tell people is if you think about it and you say, okay, I've started this on January 1st, I get it through January, February, and March. And while I may not get the support coach by text anymore after March, I do still have access to the rest of the resources. And then I'm available to sign up for that support coach by text again in January of next year. And of course, that goes by whenever you sign up. So if it's July, you get July, August, and September, and so on and so forth. So great opportunity, even if you're using it as something quick and easy, or maybe even just to balance out until you can get into other services. And then last but not least, we have updated, we used to have a program called ClassPass. We're updating that to OnePass Select Affinity. You can get some information on this by visiting kp.org/exercise. The ClassPass program that we had before does end on 12/31 of 25. So OnePass Select Affinity is a subscription-based fitness and well-being network. We don't have any long-term contracts. You pay it month to month. You can cancel at any time. You can change tiers. So the tiers vary by cost and by services that are offered within the tiers. You can browse the locations in each tier before you decide which one you want to purchase. And then alternately, you can add friends and family 18 and over at a 10% discount. So great opportunities there as well, just to be able to keep yourself moving. And I think after that, I'm going to pass it to you, Mackenzie.
Yeah. Lillian, if you are in here still and want to jump in, she'll be taking you through all the Willamette dental benefits here.
All right, I am here and ready. Good afternoon. On behalf of Willamette Dental, we are thrilled to be one of your dental options. We have been providing proactive, evidence-based dentistry along with affordable benefits for the last 50 years. Treatment on this plan is performed specifically by a Willamette Dental dentist in one of our dental offices. Electing Willamette Dental means changing your dental provider. If you are currently seeing a private practice dentist, you would need to establish a new relationship with a Willamette Dental dentist. As you can see from the summary of benefits, there is no annual maximum, no deductible, and no waiting period. With Willamette Dental, you have a copay per service. A copay is a set dollar amount that you pay, and the insurance covers the remainder. So it's a super easy system. In the diagnostic and preventative section, you will see that all the treatments listed are covered with a $15 office visit copay, and that is the portion that you owe at the time of your visit. Major services have an additional copay on top of the office visit copay. For example, if you need a crown, you will pay the $15 office visit copay in addition to the $200 crown copay. Moving down the summary to orthodontia. Orthodontia or braces are covered for both adults and children enrolled in the plan. You would pay the $2,300 copay along with the applicable $15 office visit for every visit, and the insurance covers the rest. Below ortho, you will see the dental implant benefit. This benefit is unique. Unlike the rest of our benefits, this has an annual maximum. For implants, we will cover up to $1,500 towards the cost of implant surgery, and you will cover the remainder of the balance. I will briefly touch on our dentists and our philosophy. Our dentists practice evidence-based dentistry. Our evidence-based approach to treatment focuses on prevention and stopping the root cause of both tooth decay and gum disease. We use the most current dental science along with the dentist's years of experience and your specific needs to custom tailor a treatment plan that's right for you. Through evidence-based dentistry, your dentist is going to provide the number of cleanings needed based on your oral and physical health, as opposed to other plans where you have 1 to 2 visits per year. We schedule visits based on need. So if you need 1 visit a year and your mouth is fairly healthy, we will see you once a year. And if you need to be seen 3 times a year, we'll see you 3 times a year. It's all based on the status of your mouth at that time. And there are no imposed plan limits.
Oh, I think you got muted.
Apologies, everybody.
Oh, you're back.
We have 50 convenient dental office locations throughout Oregon, Washington, and Idaho. All offices offer general dental care, and specialty care is available at about 3/4 of our offices. So the quality dental care you need is always nearby. Whether you need an exam, a filling, root canal, braces, or dentures, Willamette Dental can manage your oral care needs. Standard hours for our offices are Monday to Friday, 7 a.m. to 5:30 p.m., and select Saturdays.
Oh, I think we lost you again, Lillian.
Oh my goodness. I am so sorry, guys.
You're fine.
Currently, you can schedule appointments via phone through our member line or via online chat on our website. Canceling appointments and rescheduling is completed by our call center using the same member number. Emergency appointments are available within 48 hours or less, and we provide 24/7 on-call providers. We encourage you to check out our dentists on our website. We are proud to be one of the first dental providers to post unfiltered star ratings and comments for our dentists and dental offices based on your feedback. Once you choose a dentist, you will pair with the same care team for all your visits with the freedom to change dentists or offices if you need or desire to. With Willamette Dental, you do not need an ID card. In fact, we do not issue patient-specific ID cards. To make an appointment, all you need to do is give us a call and provide your name and date of birth. Our goal is to make things easy, to partner with you, and to do our best to provide the care you need, as well as improve your oral health. Thank you so much for sharing this time with us.
Thank you, Lillian. All right, next up we have Max with Mutual of Omaha to touch on the dental.
Hi, Mackenzie. Before we get there, we do have a question on KP from Sheila Connors.
I'm working on typing that answer right now.
Oh,
Okay.
wonderful. Thank you, Cindy.
Thank you.
You're welcome.
All right. Hi, everyone. My name is Max with Mutual of Omaha. I am the employee benefits sales rep for the Portland territory. We handle one of your dental options as well as the life and disability insurance and a few supplemental benefits. We'll start with the dental, and then later in the presentation, I get to come back and talk about life, disability, and the supplemental benefits. So with Mutual of Omaha, our dental plan is a little bit different. Rather than an office copay for each of your visits, the services that you are receiving are based on a reimbursement schedule. I'll start up at the top. You have a $2,000 calendar year max that goes towards your Type B and Type C services. Your Type A services do not count towards that annual max, and in network, they are covered at 100%, as well as out of network. So if you go and get an exam done, your x-rays done, space maintainers, anything in that covered services, it's covered at 100%. Excuse me. We also have an orthodontia benefit here. It is a $1,000 lifetime maximum, and it is also covered at 50%. The Type B and Type C services will be covered at 80%. Think of your fillings, oral surgery, endodontics, surgical extractions, things of that nature would be covered after you've met your deductible at 80%. Your Type C services, these are your major services, things like bridges, cast crowns, inlays, onlays, and dentures would be covered at 50%. Now, the other difference between us and Willamette is if you go out of network, you will still receive benefits. You can still be reimbursed. However, our out-of-network reimbursement is a little bit different. In network, we have a contracted amount with those in-network dentists, meaning that, for example, if you go get an exam done in an in-network dentist, it's written off 100%. We have a contracted amount, a contracted reimbursement with that dentist. We'll pay for it. If you go out of network, if that out-of-network dentist has a higher cost for that amount, you may get balance billed on what Mutual of Omaha would reimburse versus what that out-of-network dentist is paying for, is billing for. Any other questions on that so far? I know I spoke pretty fast.
I don't see any in the chat, so I think we're good.
All right, nothing's changing here for this year. So if you do have any questions, drop it in the chat.
Perfect. Thank you, Max. We'll talk to you later. For now, I'm going to take over and go over the VSP vision benefits for you all. Similar to all the other benefits we've talked about, there's nothing changing on this plan. So if you're familiar with the VSP vision, this will be easy for you. But we will run through the benefits just for anyone new or unsure on what the vision plan covers. So your well vision exam is going to be covered at a $10 copay every calendar year. This is going to be in addition to a Kaiser vision exam if you are enrolled on the medical plan. This is separate from that. And if you do need hardware, so frames, lenses, contacts, this would be the plan for you to consider because the Kaiser plan is only a vision exam. There is no hardware coverage included in the medical. For your frames benefit, this is an every year benefit, which is awesome for those of us that like to change up our frames every year. I personally don't like waiting every 24 months, so this is a great frequency benefit here. And the allowance that you have to spend on your frames is going to depend on where you go. So you're going to get a little more bang for your buck if you go somewhere like a Costco or a Walmart, Sam's Club, because they get better deals with the vision frames providers. If you go to your in-network, just general vision provider, like a box store or like a boutique, you'll have a different allowance. So any of the featured frames, which are the preferred brands, you're going to get $170 to spend on your frames. Anything else is $150 allowance. And then there's some additional savings on top of that if you go in excess of your allowance. and some different upgrade fees if you do choose any special lens enhancements. If you prefer contact lenses, there is a benefit for contacts in lieu of glasses. So you get one or the other. The contact lens allowance is going to be $130. And again, that is every calendar year. There are some extra perks and savings associated with this plan as well. If you want things like prescription sunglasses or laser vision, there are some programs here that provide you additional discounting. Okay. We'll pivot a little bit into spending accounts now. If you are currently enrolled on the flexible spending account or the dependent care account with Paylocity, and you want to continue participating in 2026, you do need to log in and do a new election. The IRS requires it every year. And this year for 2026, the election maximums are changing. So the flexible spending account election maximum will go up to $3,400 with a rollover benefit from 2026 into 27 of $680. The dependent care account is increasing to $7,500 per household, which is crazy because this benefit has never actually increased. So it's a great investment here, a great perk. If you're currently enrolled and you have money and claims to be submitted to either of these plans, you need to do that by March 31st of 2026 so that Paylocity can process your reimbursements and get you the funds that you're due. Some of you might not be familiar with a flexible spending account and might be wondering what it is. So an FSA is a tax advantage account. It lets you take money out of your paycheck pre-tax and put it into this flexible spending account and use it tax-free for things that are considered eligible medical expenses. Very vague, but basically any kind of medical, dental, vision expense, plus a lot of over-the-counter things that you're probably already buying. And then also for qualified dependent care expenses if you are electing that DCA. Who's eligible? So if you are eligible for benefits through Willamette Vital Health, you are also eligible for this FSA or DCA. It does not require that you enroll in any other benefits. You can waive everything else, decide to enroll in this FSA, and that is totally okay. And again, it allows you to save money. So there's some pretty great tax advantages here on both of those plans, the FSA and the DCA. Because the money's coming out of your paycheck pre-tax and then you're using it tax-free. So it does provide some significant tax advantage there. For the flexible spending account, you will be issued a debit card, which we'll go over later. But that card is going to be loaded with your FSA funds, and you, your spouse, and your dependents are all able to use that card to pay for qualified medical expenses. Children up to age 26, regardless of if they're living at home or are a full-time student, are considered dependent children and can use it. So circling back to those eligible expenses, basically everything we've touched on in this presentation, medical, dental, vision-wise, is an eligible expense. So you can pay your copays, you can pay your vision frames expenses, you can pay any of your dental needs with this card. You can also pay for over-the-counter things like sunscreen, pain relief, first aid kits, Band-Aids. It's incredible what is considered eligible. If you want a good look at the kinds of things you can buy, or if you are in the camp that needs to spend down your FSA funds for this year, I highly recommend checking out the FSA store. It's online shopping and it's delivered straight to your door. It's amazing. They have everything on there that is eligible for this FSA, and you'd be surprised what you can find. So we mentioned the carryover limit is changing for 2026. For 2025, if you are currently enrolled, the current rollover benefit is $660. So I would go on to Paylocity, check your account balance today or tomorrow. If it is over $660, you are risking losing those funds in excess of $660. At the end of the plan year, if you have $660 or less remaining in your account, those funds will all carry over into the 2026 plan year, regardless of if you make a new election or not. They also will not reduce your election maximum amount. So if you have that full 660 carryover, you want to max out your FSA for 2026, on January 1st, your total FSA dollars available would be $4,060, which is pretty awesome. Anything in excess of 660 is going to be lost. And we really don't want you to lose your funds because they came out of your paycheck throughout the year. So it really is your money, and we want to help you access it and use it so you're not in the camp of over electing and potentially losing your hard-earned money. If you are new to the FSA this year, you will receive 2 debit cards in the mail from Paylocity. They come in a very nondescript white envelope that can often be mistaken for spam mail or junk. Please don't throw it away. Be on the lookout for that if you're newly electing this FSA plan. They will be mailed straight to your home. If you're currently enrolled and you have a card already, hang on to it because it's good for 5 years. So you won't get reissued a card this year unless you've been on this plan for 5 years and you're due for a new card if your card's expiring. Replacement cards do cost $10 to reissue. If you call Paylocity and try to request a new card, they will charge you $10 every time. If you call us, we might be able to get around that. No promises, but sometimes we're able to get that fee waived for you. So that was all the flexible spending, the medical, dental, vision expenses. We're going to pivot into the dependent care account, the DCA. So this plan is really designed to reimburse you for expenses that your children under the age of 13 are incurring via childcare or camps, things of that nature. And in some cases, adult dependents may be eligible for this as well if you're claiming them on your taxes and if they are physically or mentally incapable of doing daily living activities on their own, if you're paying for assistance for them. Again, so that could look like adult daycares, after school programs, preschool daycare, some summer camps, as long as they're not overnight, will also qualify, which is pretty cool. In contrast to the FSA, the dependent care funds are not loaded onto a debit card for you to use. So you will be having to collect receipts from your providers or your caretakers and submitting manual claims to Paylocity to be reimbursed. That can be done via email, their mobile app, online on their website, fax or mail if you're into that. But it is a manual process that you have to submit for. So for both of these spending accounts, it is important to note that you have to make your election during open enrollment. It'll be effective January 1st. The election will come out of your paycheck evenly throughout the year, and you aren't able to change it unless you have one of these types of qualifying events. So be very mindful in what you're doing for your election so that you're not electing too much or too little, because if we get to March or April and you realize that maybe your FSA election wasn't right, there's really not a lot we can do to help you correct that outside of having a qualifying event. And if you do need any assistance from Paylocity, if you have questions on your account or claims or anything of that nature, here's their phone number, their email address, office hours. You can always contact them. If you do need additional assistance with getting to the bottom of claims questions or getting service with Paylocity, you're also welcome to contact my team as well. We're happy to help. I'm going to pass it back to Max for the rest of our Mutual of Omaha lines.
Hi, everyone. I'm back. We're going to go over the life and disability. I'll start with the employer paid that you have been provided for, as well as your voluntary products and your options for this open enrollment period. The first is basic life insurance. Basic life insurance would pay a benefit to your beneficiary in the event you were to pass away. Willamette Vital Health has paid for $10,000 for yourself, as well as spouse coverage in the amount of $1,000 and dependent child coverage in the amount of $1,000 as well. Because this is paid for by your employer, the only action you need to take during this open enrollment is I would update your beneficiary if that's changed in the last year, something I would draw attention to. Next slide, please.
Oh.
Oh, okay. Short-term disability, this would cover your paycheck. We call this paycheck insurance. If you are sick or injured and unable to work, short-term disability would pay 60% of your weekly earnings up to $1,000 per week. I do want to explain that short-term disability does offset with paid leave Oregon. So if when you are claiming benefits, our short-term disability benefits with Mutual of Omaha, they will be offset by the amount you receive in paid leave. The difference is paid leave, medical leave is it's a excuse me, a serious medical condition. Is the language there. And with Mutual of Omaha, you have the option to take partial disability benefits. If you're working, maybe a couple days a week, and you've experienced an earnings loss, I'd file a claim with Mutual of Omaha so that we can make you whole. Next one. All right. At the end of your short-term disability period, if you are still disabled, you would transition into long-term disability. Long-term disability covers your monthly paycheck at 60% of your monthly earnings up to $5,000. You can stay on benefit or long-term disability benefits to what's called Social Security normal retirement age, or 3.5 years, whichever's longest. Usually that's age 65 or age 62, age 67. It depends on your current age now. All right, a couple of our value add services. These are also available at no cost to you. Our employee assistance program provides counseling for any life events you are experiencing. Any issues with relationships, children, financial wellness, legal assistance. Our employee assistance program is available 24/7 with master's level counselors to help with any issues that you're having. As well, we have a hearing aid discount program through our partnership with Amplifon. We offer half off of hearing aids as well as discounts on batteries. They're not listed here, but there are a few other value add services that I want to draw attention to. Travel assistance. If you are traveling over 100 miles away from your place of residence, there are services such as, luggage assistance if you lose your luggage, if you need any emergency funds while you're away, any medical emergencies, there are resources for that. There are, there's a number that you call, and there's some ID cards for that. So I reach out to HR, who I believe has those brochures. And then a will prep service, which is also not listed here. Going to www.willprepservices.com and typing in mutual wills, all caps, no space, you have the option to build out and print a will for yourself. There is a fee to get it notarized, but there's no cost to get it made and printed and go in and get it notarized yourself. All right, now we're on to the voluntary benefits. Currently in this enrollment period, your voluntary term life, you have the option to increase coverage if you are already covered. For example, down on the bottom left corner, we have the guarantee issue amount. If you are below that guarantee issue amount and you would like to increase coverage up to $20,000, you have that option without having to answer what we call evidence of insurability or medical questions. You won't have to answer any medical questions. If you do not currently have voluntary term life insurance, but you want to enroll, you still can. Just know that new enrollees during this period would have to go through our evidence of insurability process. All right. Now, the last two benefits I'll go over are in open enrollment, and these are what we call our supplemental benefits. These benefits are designed to offset any out-of-pocket costs that are associated with getting sick or injured and going to the hospital. The first benefit is accident insurance. This benefit pays a lump sum to you if you are injured due to an accident. I'll give you an example. Myself, I actually had an accident earlier this year, back in February. I ruptured my patella tendon, but thankfully I enrolled in Mutual of Omaha's accident insurance back in January. So I received a benefit for my emergency room visit, for my surgical repair of my knee, for my physician follow-up visits, as well as my physical therapy. I paid about $4,000 out of pocket. Mutual of Omaha reimbursed me $5,200 for that situation. So big fan of this benefit. Next one, please. And then the last is critical illness insurance. This would also pay a lump sum benefit to you if you or any covered members are diagnosed with a critical illness. The most common ones that we see claims for are heart attack, cancer, and stroke. But as you can see on the screen, there are a number of different illnesses that would be covered if you were diagnosed with them. For this benefit, you have the option to elect up to $10,000 of guarantee issue, meaning we're not going to ask you any medical questions. You can elect higher than that. You can go up to $40,000, but if you do exceed the guarantee issue amount, we will have to go through the evidence of insurability process. Both of these benefits, the critical illness and accident, are independent of your medical coverage. We're not going to offset any benefits paid out based on what you've paid out of pocket. It's just based on, the individual triggers that could happen if you are sick or injured.
Perfect. We'll pass it over to Ashley to get us in the home stretch here. Thank you, Max.
Hey everyone, I'm Ashley with Trucordia. I'm going to go over the Transamerica benefits with you. New this year, we actually have updated the guaranteed issue amount, so no medical questions. So for a new hire, it's up to $150,000 with a long-term care benefit up to $300,000. And then if you've waived it previously, the new part is that you can actually get this benefit up to $100,000 with no medical questions. So if you've had a medical situation happen in the last year and you might have waived previously, it may kick you out. This might be something to look into. So a couple of things I want to highlight is, so this plan is a universal life that has a rider on it called the Living Benefits for Long-Term Care. What that means is the universal life is the life insurance. This one actually goes to age 100. The rates are already guaranteed up to that age 100 mark. The living benefits for long-term care allow not only a long-term care facility or a nurse that comes in your home, or a certified professional or permanent professional, what they call, to be able to take care of you, but the living benefits also allows a family member to take care of you as well, which is really, really important. So all of this is designed to pay you directly, so you can use it toward the facility, medical expenses, whatever you need to help take care of you. So the great thing is, no matter which way you go, you're going to get some type of money out of this plan, whether it's your loved ones are going to get it, as a life insurance, as a beneficiary, or if you need it for the living benefits for long-term care, you're going to get money back out of this. This policy is portable, so you can take it with you at the rates that you did sign up at. So rather than being directly on a payroll cycle, then you could do it. You could set it up monthly, quarterly, annually, however is best for you. Once you leave the company, I always like to say when you retire, because you're going to stay here long enough that you're going to use it all the way into retirement. And I'll touch base on the next slide on the actual how the payments work out. But it is a guaranteed cash value right now of is a guaranteed at 3%, but it's currently at 5.25. And I will let you know that that has not changed. I had this exact policy mainly because of the living benefits for long-term care. I did hospice on my grandmother. My mom's the only child. I'm the only child. Don't have kids. I do have a husband and I have great dogs, but they're not going to take care of me like I really need to. So, and my family tends to try to live forever. So I was really concerned about the long-term care side of everything. So this policy was really important to me. Mackenzie, will you go to the next one and I'll kind of touch base on this. So I'm going to focus just kind of a little bit in the middle, right at that 25,000 mark. I think it's the easiest one to understand when we're talking about everything. So let's say you chose a $25,000 life insurance amount. If you passed day one, you're going to get that 25,000. What it does is it actually doubles for the living benefits for long-term care. And when you break down all the math that goes behind it, the 4% for 50 months, what it does is it gives you $1,000 per month for up to 50 months. That's all you need to remember. For every 25,000, you get 1,000 in the living benefits for long-term care. So that kind of helps. And as you go up, so yeah, all the way up to that, you can see all the way up to the 150, it gives you $6,000 per month. If you were to exhaust, meaning you used up all that living benefits for long-term care, it's not just going to go, the policy is just not going to go away. It's actually going to still give you up to 25% of your original face amount for final expense. And I can tell you from personal experience recently that funerals run around about, at least a nice one that I did for my dad was around 13,000. So kind of gives you an idea of what that can cost and that kind of look like. And you can kind of see the rates, and those are just weekly examples below there, but kind of give you an idea on that. The prices are in Employee Navigator and already pre-set up for you. If you have it currently and you just want to keep everything the same, great. It will roll over next year at the same rate you signed up at. But if you want to make any changes, you can do that up to the guaranteed issue amounts. And one quick thing that I wanted to touch base on is a lot of people, our most common question we are asked is regarding, well, I have a term policy. Why do I need this? And they kind of go hand in hand. What you kind of look at, and at least in our professional opinion, for term policies, you kind of look at that during your working years. When you have more expenses, you might be paying for a house, you might be paying for student loans, you might be paying for any additional things. So your higher income at that point, you have a lot of stuff going on, paying for child care, whatever you need during that period of time where you need a little bit more. That's great there. And then you have the something for into retirement. So think about this as being kind of a little bit part of your retirement portfolio in that situation to kind of help, have the life insurance going into your retirement, and carrying on through the rest of your life at a rate you locked in at. Especially if you're young, kind of look at it that way because you can lock in. It's so cheap for so much more, and you can kind of see the difference in how quick it can jump in a 10-year increment. And it's not going to change when you get into that next increment. Like I'm about to turn 40, it's not going to change when I turn 40. So I've locked in. I think I got it when I was 34. So yes, 34. So it's locked in when I was 34. So that is it, but I'm happy to have any questions or answer any questions for you too.
Wonderful. Thank you, Ashley. Final benefit that we're going to review here in our last minute is just FIGO pet insurance. You are free to sign up for this whenever you need it. Maybe you don't have a pet now, but you might get one later on in the year, or you might want to just sign up for the insurance later on in the year. The link is posted in Employee Navigator. Just know that this does not cover your routine animal care. It won't cover the normal vaccination schedules and things of that nature for dogs, but it will cover those costly accidents, illnesses, weird things that dogs tend to get into. And that's all through FIGO and posted in Employee Navigator for you to go explore on your own. Pricing will be based on breed and age and all of those types of things. And then just our friendly reminder, get your open enrollment done as soon as you can. Help out Ronell and the team over there. Try and get it done tomorrow when the email goes out. Don't wait until November 30th because that's a Sunday. And I don't think Ronell and Teresa and them want to be helping you through Employee Navigator on Sunday evenings. So please,
Well,
please, please get it
we
done
will be
early.
online in case that happens, but what's really helpful is go in now and check that your password is up to date, because that's been our
Yes.
biggest question. I can't get in. I don't know what my password is. So go to Employee Navigator, get in there, fix it up, and start tomorrow, please.
Perfect. And if you do need help with lockouts or passwords or anything like that, our team is here to help as well. And just remember that this is an active enrollment for most of your lines, Transamerica being the anomaly. So go in, re-elect what you need to re-elect, change what you need to change, waive what you need to waive, and all of those enrollment changes will go into effect January 1st, 2026. If you do have additional questions, we are around. You can always contact our team. If you don't know how to get in contact with us, Ronell can certainly point you in the right direction. She has my information, and we will be here to help you through your open enrollment and anything that comes up throughout the year.
Thank you so much, everybody, for your presentations. We truly appreciate it. Just a couple of other things I'd like to add. We do have a couple of benefits that are not presented on this presentation. That would be our Legal Shield and ID Shield opportunity and our 401k program through Principal. If you have any questions on those benefits, please come and talk to us. There is no open enrollment period for those two plans. And then also we will be posting this conversation or this presentation on the portal next week. So if you missed any or a portion of it, you can go there to find the answer. And as Mackenzie said in the chat, we are working on the employee ham booklet for benefits, which will be out shortly.
Perfect. Thank you, everyone.
Thank you. Bye.
Hi, thank you.